604-535-3700 and online at www.byronstryloff.com.
Shopping for the lowest mortgage rate? Looking to refinance? Catch Jared Dreyer in the Mortgage Lab on localwebradio.fm. Buying or selling a home on the Semiahmoo Peninsula? Catch up on local market conditions on This Week in Real Estate with Lance and Connie Marples from Sutton West Coast Realty on localwebradio.fm. To schedule a face-to-face consultation, you can reach Lance and Connie at 604-538-8888. That's 604-538-8888. And visit them online at www.surreywhiterockhomes.com.
It's time now for more Healthy Smiles with Dr. Norm Ickert.
All right, we're back with Dr. Norm Ickert, and we're continuing our discussion on the examination of the whole oral cavity and its importance. Now, before the break, Dr. Ickert, we talked about the periodontal health and biomechanical health. So let's get to the other two. What are they and why are they important?
The third category that we look at is the functional component of your entire oral cavity, and that refers to the muscles that you use to chew, to open and close your mouth, your joint called the temporomandibular joint that connects the lower jaw to the skull, and also your bite. And you can also add speech and swallowing and breathing to the functional aspects of our oral cavity. And these are all issues that we have to get a good handle on. And they all have a great bearing on the outcome of the case that we treat. And they indicate how efficient your system is working. For example, if you don't have an efficient chewing machine, so to speak, you will show signs of adaptation. The body is designed to adapt to whatever imperfection comes its way. So if, for example, we have a filling that's been done or a crown that's been put in our mouths and it doesn't seat properly and it sits a little bit high, your body wants to try and avoid that. Mm-hmm. And as it avoids that, it starts to either posture forward or to the other side, and it starts to break off teeth. Or another way of adapting would be for the muscles to get sore to make you not chew so hard. Or another way of adapting would be that the teeth would become loose as the result of the excessive forces on it. So the body adapts in different ways, and it's important for us as dentists and clinicians to determine how that body is adapting to the specific irritation that it's subjected to. So the functional component is highly, highly complex and interesting, right down to the very basics of breathing. And oftentimes we can see a very constricted airway on our x-rays that we take, and that can be a real telltale sign of someone who has trouble with sleep apnea. And that's an extremely devastating condition that can completely alter the quality of a patient's life.
Now, real quick. Now, when I think of sort of adaptation, I had a bad tooth, a bad molar, I had to have a root canal. And while that was all sort of shaking out, of course, I was aware that I was chewing on the right side of my mouth instead of the left. Are there examples of sort of adaptation that occurs without the patient realizing it's happening?
I think for the most part, the patients don't realize it. The body is designed to adapt almost subconsciously. For example, if you had a mosquito bite, you would almost subconsciously scratch that arm or part of your body without even realizing it, because it would create body comfort. This comes from the limbic system of your brain. That part of the brain is designed to give you body comfort. You know, if you were too cold or too warm, the body does things almost automatically to try to adapt to it, to try to regulate the comfort level for your body. So the problem really is that for the most part, the adaptation happens and the patient doesn't realize it. And you bring up a great point, because the real key to the risk assessment is to try to figure out how the body is adapting and the damage it's doing, trying to figure that out early so that it doesn't become a problem long term. A really good example of this would be children. If you see a young child or even a young teenager and you can see wear on their teeth at an early age, because maybe the tooth position is such that when they chew, they're running into each other and they're starting to wear those teeth down, and that's the way the body has to function in order to chew. It has to grind away whatever is in the way. Now, if you can catch that early in that child and maybe through orthodontic treatment, bring those teeth into a better alignment, you can actually prevent significant long-term dental problems and expense for that patient by just correcting that problem early on before the adaptive process gets so severe that now you need to do a reconstruction on that mouth. So I really am such a strong believer in early detection of the adaptation process.
All right. So now we got one more, right?
Right.
All right. Let's hit it.
The final question that we look for, or the final risk factor that we look for, is the overall dental facial health. And this is not just a cosmetic condition. We're looking at the entire symmetry, the balance, and the harmony of the entire face. And we divide that face into thirds. We start from the top of the head, then we take a third down to the bridge of the nose. From the bridge of the nose, we go down to the upper lip, and from the upper lip, we go down to the chin. And that technically should be equal thirds. So that right away tells us if that face is proportioned in a harmonious fashion, because oftentimes people would like to have the ideal aesthetic reconstruction, but if the overall jaw and face aren't proportional, then even making the teeth look really nice may not give them the outcome that they're looking for. So sometimes we do have to change the jaw position slightly to create a more ideal aesthetic profile. But really, that's more of a severe case. But what we're really talking about for the most part is a symmetry and a balance and a harmony with the gums and with the teeth. And when you have the gum line in a beautiful, harmonious, scalloped form, like a picture frame surrounding those teeth, and then you have the teeth with the right proportions of length and width, and they are aligned ideally with the nice color, it instantly gives you a sense of well-being. And just simply having some balance and harmony, and I'm not talking about perfection, because perfection is virtually impossible and unrealistic, but just having a sense of that harmony and balance is what gives people a sense of well-being. And I can tell you that every day we have people coming into our office that either have lost a front tooth or they've lost a lot of teeth and they don't feel good about their teeth, and they're just sitting with their hand in front of their mouth, and they are very emotional about how their teeth make them feel in general. As a human being, has a great impact on their self-esteem and self-awareness, and it can actually become quite a social disability when you don't feel okay about your smile.
So we've got these four areas. We've got periodontal health, biomechanical health, functional health, dentofacial health, and these are all that you check out after the risk assessment, after the dental history, medical history. I'm reviewing my own knowledge here.
Right.
Then, so we have all this. And are there any stories you'd like to share after we've gone through all these steps about the importance of all of this, the power of being able to help somebody through something or identify something that they didn't realize was a problem?
Sure, Nick. I have two quick stories that I think are really important. They're right in my office, in our office, and patients that we see on a regular basis. One patient came to us as a new patient just a few weeks ago, and she said, I'm really worried about my recession. I feel that the gum is really getting too high on the front tooth, and she's got this gorgeous smile, and I look at this thing, and I can't really quite figure it out, and I said, you know what, to really test this out properly, I have to numb you up, and I'll just have to check to see where the bone is. And as I do the checking, I realize the bone is actually not in the right spot. What's happened is that the gum on the tooth that she thought was the problem was actually in the right spot. It was all the other teeth where the gum hadn't receded back to its ideal position when the tooth comes out. Of course, not only does your tooth drop down, but your gum recedes up. And the rest, even though she was a full-grown adult, her gums never actually receded to the normal position based on where the bone is. And so it was the exact opposite treatment of what she thought it would be, and we numbed her up, and we just simply trimmed away a little bit of the bone on the facial aspect of the roots, just allowing the gums to be able to naturally pull up to where they would like to go. And now she has got the most absolutely beautiful, gorgeous smile. We didn't have to do any gum surgery, any major way. All we did was just trim that bone a little bit to allow the gum to recede to its normal position. And it was a nice example of doing a proper risk assessment to give us the diagnosis, which ended up giving us a very conservative treatment with an amazing outcome.
That's amazing.
And the other case I want to just quickly mention to you is that I have a patient who was basically born and raised in Japan, and with a fairly affluent environment where she grew up in, and she just unfortunately struggled with amazing issues with decay and had such a horrible experience. And the minute she came into the office, she would just break down and cry because of the horrific memory she had of her dentition. And this is an absolutely drop-dead gorgeous individual, and she just felt so incredibly uncomfortable with her breaking teeth, and she had so much pain. And this is a patient where the risk assessment showed us that virtually the majority of her teeth could not be salvaged because of the incredible attack of the acid and the bacteria in her mouth. And so doing root canals and crowns would have been of no value to her. So we actually made the decision to remove her upper teeth, which was a huge step for this beautiful woman to now all of a sudden end up with no teeth. We placed 6 implants, we did some bone grafting, and now she has a most gorgeous smile, which is completely built on titanium implants, which can no longer rot. We have completely addressed the risk, and the bacteria cannot affect the titanium anymore, and she can actually look forward to having a beautiful smile with confidence for the rest of her life now. And it has absolutely changed her life. And it's so wonderful that we have these abilities nowadays with a proper risk assessment and good therapy to truly make such a monumental change in people's lives. It's why we get up and come to work every day. We have that opportunity, whether it's one tooth or whether it's a whole mouth, it doesn't matter. It's the idea of knowing what we're doing because we have taken the time to do a proper risk assessment, establish a proper diagnosis, and now presenting the treatment options based on that diagnosis, and you can be confident that that treatment is going to provide you with an outcome that will lower the risk and improve the long-term prognosis for that patient. So it's a very predictable feeling. It gives you a great sense of confidence. So it's a very fulfilling experience to be able to have that type of impact on our patients.
We are out of time. And if you know somebody who would benefit from what we have talked about today, please go ahead and share this podcast with them. I know they'll love to hear what Dr. Ickert has to say. You can reach Dr. Ickert at www.ickertdentalimplants.com. That's ickertdentalimplants.com. And you can reach his office by telephone at 604-881-1381 or call him toll-free at 1-866-931-1981. Dr. Ickert, thanks so much.
Thank you very much, Nick. I thoroughly enjoyed it.
Thanks for listening. At Ickert Dental Implant Center, we are committed to providing you with the very best in modern and advanced dentistry. If you would like more information about dental implants and our extensive range of specialized dentistry services, please call us today at 866-981-1381. That's 866-981-1381. Or visit us on our website at www.ickertdentalimplants.com.
Local stories, local voices. We're localwebradio.fm.